So, hello viewers, welcome to another session. And today's session is going to be very interesting because today I will discuss about one interesting topic, that is multiple myeloma. So, what is multiple myeloma? I'll be looking into it. So, before starting today's topic, let's understand the basics of multiple myeloma. So, uh, as we all know that plasma cells, these are the plasma cells. These cells are actually mature B cells, and these mature B cells means B lymphocytes, and these mature B cells, they produce different kind of antibodies. As we know that antibodies are basically produced within our body to fight any organism that has entered our body. There are various types of antibody. One is IgG, another one is IgM, then IgA, IgD, and IgE. Now, let's understand the basic structure of a antibody. Now, this is IgG and it has two arms. These are the FAB portions or FAB portion. And this small part, this is known as FC portion. And here also you can see that these long chains, this long structure, this is basically heavy chain of one antibody, and associated these smaller structures, as you can appreciate here, these are the small chains. So here we can also explain it like that. Just a minute, give me some time. So here in IgG, this small structure, that is light chain. Here is also another small structure. This is one light chain. And here, this longer structure, this is a heavy chain. So antibodies are comprised of two light chains and two heavy chains. So this is the structure of antibody. Now, what happens in case of multiple myeloma? In case of multiple myeloma, there is proliferation of these plasma cells. So, there is proliferation of plasma cells within bone marrow. So, how it looks under microscope? So, this is the uh, bone marrow aspirate of a patient from multiple myeloma, and this aspirate is showing there is presence of numerous plasma cells. How to identify these plasma cells? These plasma cells, they are basically these plasma cells, they have eccentrically placed nuclei. That means the nucleus is pushed to one side of the cell, and the cytoplasm, that is bluish. And also you can appreciate in few cells that there is a perinuclear HOF. That means there is lighter area of staining in the perinuclear region. Here you can also see that there is presence of perinuclear HOF. And this is a normal bone marrow. This is a normal bone marrow. Here, this is a biopsy from bone marrow. Here you can see that there are different types of cells. So this larger cell, this is one megakaryocyte that produce platelets within our body. This is another megakaryocyte. And these small darker cells, these cells are basically red cell precursors or erythroid cells. And there are intermediate some cells like this one. They are myeloid precursor cells. They are concerned with production of the neutrophil, eosinophil, basophil, etc. So this is a normal bone marrow. Now, what happens in case of plasma cell myeloma or multiple myeloma? There is proliferation of this plasma cells and they gradually replace the marrow. So that means in case of multiple myeloma, the marrow is comprised of predominantly plasma cells. So these normal precursor cells like megakaryocytes, erythroid cells, or myeloid cells, their number is reduced in case of multiple myeloma. And as because of that, different manifestations develop. Now, what are the clinical features of multiple myeloma? Now, the first effect, that is the bone marrow effect. That means there is replacement of the bone marrow with plasma cells, and there is relative decrease in number of normal blood forming cells. So there will be anemia, there may be presence of neutropenia, there may be presence of thrombocytopenia. So, due to anemia, there may be presence of weakness, lethargy, shortness of breath, etc. Due to less number of neutrophils, there may be uh, increased chance of infection. Due to less number of platelets, there may be presence of bleeding or any purpuric spots, etc. Now, these plasma cells, these abnormal plasma cells, these clonal plasma, what does it mean? Clonal means these abnormal plasma cells, they are produced from a single cell. So, this is monoclonal, that is derived from a single cell. So, so it is a clonal or monoclonal cell. And these abnormal cells, they produce abnormal antibody, or sometimes some abnormal proteins are also produced, which is known as M protein. And sometimes in urine we find some kind of abnormal protein that is known as Benston's protein. In case of myeloma, these abnormal proteins, they can precipitate within the renal tubule and they cause renal impairment. Also, as there is less production of the normal antibodies, these patients who are suffering from plasma cell myeloma or multiple myeloma, they are prone to infection because they lack normal immunoglobulins or antibody. Now, these abnormal plasma cells, they produce various interleukins or inflammatory signals, and those inflammatory molecules, they produce osteoclastic activation. So as a result, there is increased bone turnover, and that can result in hypercalcemia or high calcium level within blood, and indirectly that can produce nausea, confusion, or constipation like symptoms. Now, coming to the some radiological manifestation of this disease. Here in this X-ray, you can see there are few areas, abnormal areas. These areas are known as lytic lesions. These lytic lesions are one important feature of multiple myeloma, and these lytic lesions, they make the bone weak, and these bones are easily they get fractured even without any trauma. And that abnormal fractures, or those fractures that occurs without any trauma or with trivial trauma, these kind of fractures are known as pathological fracture. So this is pathological fracture is one feature of multiple myeloma. So let's come to uh, the diagnosis part. How to diagnose a case of multiple myeloma? So, what happens here? in case of multiple myeloma, the normal antibodies are uh, not produced, or they are produced in a lesser amount, and there are abnormal antibody productions. These antibody can be a full antibody like containing two FAB one FCR, or it may be a single light chain also. And these abnormal antibodies, they make the blood thick, and that can result in rouleau formation, that is seen over here. There is stack of coin appearance. That means these abnormal antibodies, they make the surface of the RBC so sticky that they are attached with one another like a stack of coins, and these abnormal structure, this is known as rouleau formation. As you can see here, there is clump like aggregation of the RBC. So this is one finding in the peripheral blood film. Now, serum protein electrophoresis. What does it mean? Here, different proteins of the serum, they are separated with application of some charges. And here is the graph that showing presence of albumin, alpha 1 globulin, alpha 2 globulin, beta globulin, and there is another additional peak, and this is basically M protein, and this is called M band. So this is one of the important feature of multiple myeloma. And these M bands, they are basically the abnormal antibody or abnormal protein that is being secreted from these abnormal plasma cells. These M band can be formed due to excess amount of abnormal antibody, or it may be formed due to presence of excess amount of light chains. So light chain can also make one M band also. Now coming to the next investigation, that is serum free light chain ratio. So every antibody has this pink colored chain, that is heavy chain. So there are two heavy chains and there are two green chains. These are the light chains. So there are two heavy chains, two light chains. These heavy chains are either of gamma, alpha, mu, or delta type, but the light chains can be either kappa or lambda type. So, in normal plasma cells, there are presence of both kappa and as well as lambda type of light chains. But in case of plasma cell myeloma or multiple myeloma, there is excess production of a single type of light chains. That means there may be presence of either kappa in excess amount or lambda. So this is known as abnormal free light chain ratio. This is one of the important tests to diagnose a case of multiple myeloma. There will be excess amount of either kappa or lambda type of light chain. The next investigation, that is bone marrow aspiration and biopsy. What you see in case of bone marrow aspiration or biopsy, there is excess number of plasma cells. Either they are mature like plasma cells, or there are some immature forms of the plasma cells. There are binucleate cells, and there are various abnormal morphology of plasma cells. So in bone marrow aspiration or biopsy, we find excess number of plasma cells. Usually, the plasma cells are more than 10% of the total bone marrow nucleated cells. Now, let's come to another interesting test in diagnosis of multiple myeloma. So, here we can do urine protein electrophoresis as well, just like the serum protein electrophoresis, where you can also find one M band or M protein or M spike, whatever you say. But there is additional one test, that is to detect Bence-Jones protein in urine. So what you do? So you take a urine sample in a test tube, you just heat it. When it reaches 60 to 70 degrees centigrade, there will be presence of haziness, there will be presence of some protein deposits, and on further heating to 100 degrees centigrade, these haziness it will disappear. That means the precipitation which has already formed that will dissolve, and again when cooling it reaches 60 to 70 degrees centigrade, then again the haziness will reappear, and after further cooling it will also disappear. So this is the test to detect Benz Jones protein. Okay, so if the urine sample contains Benson's protein, we say it that there is Benson's proteinuria is present. Now coming to the interesting part, that is the treatment. How to treat a case of multiple myeloma. So there are various options to treat multiple myeloma. One of the commonest option is chemotherapy. Another option that is immunotherapy, or you can do a bone marrow transplant, typically, especially autologous hematopoietic stem cell transplant, or there is also role of radiation therapy. Now, in chemotherapy, we give different combination of drugs. We can give a doublet regimen, that means combination of two drugs, triplet regimen, quadruplet regimen. There are a lot of treatment options depending upon the stage of the disease, the patient's general well-being, his or her comorbidities, uh, and and also presence or absence of some abnormal or bad molecular markers. These therapies are decided. So, what are the commonly used drugs? The first one that is bortezomib, next carfilzomib. There is one drug, dexamethasone, that is very common, as you all know, that dexamethasone is a steroid. This is also found to be very helpful in controlling multiple myeloma, but it is commonly used in a combination with some other medications. There is one immunomodulatory drug like lenalidomide, thalidomide, and also pomalidomide. These are also used in case of treatment of multiple myeloma. Now coming to the immunotherapy. Immunotherapy means there is specific expression of some antigen on the myeloma cells, and we will target those specific antigens with the help of some monoclonal antibody, and one of them is daratumumab, and daratumumab is the anti CD38 antibody. So as we know that the myeloma cells they express the myeloma cells they express anti CD they express CD38 molecule on surface, and this daratumumab it will attack this CD38 molecule. So this is one kind of immunotherapy. Immunotherapy has some advantages and also it has some drawbacks. One of the major advantages, it is tumor specific. That means the side effects are much less, and also it controls the disease to some extent in a better way. There is another monoclonal antibody that is elotuzumab. And regarding hematopoietic stem cell transplantation, the most common type of transplantation that is we commonly do, that is autologous hematopoietic uh, HSCT or autologous hematopoietic stem cell transplantation. But in a few cases, allogenic HSCT CT can also be done. Now coming to some advanced or very recent treatment modalities, like bi like just a minute, like bispecific antibody or bi and CAR T. Now bispecific antibodies are some uh, developed antibodies, some antibodies those are developed in labs, which are specific for some molecules on the surface of plasma cells, and those bispecific antibodies they also target the CD3 marker on the T cells, and thereby they cause activation of the T cells, and those activated T cells they kill these myeloma cells. And in case of CAR T cells, uh, here some lymphocytes are taken out from the patient's body, and those lymphocytes are modified in some CRISPR-Cas9 edited technology, and those edited lymphocytes, they are again infused back to the patients, and those lymphocytes, they are basically primed against some specific antigens on the plasma cells, and they attack the specific plasma cells, and they destroy the plasma cells within our body. Now, coming to the prognosis, one thing you have to keep in your mind, that this is this is one incurable condition, but uh, we uh, we have to control this disease with the help of different modalities of treatment, and the goal of this therapy is to control the disease, and thus to improve the quality of life in a patient. So nowadays there are so much advancement in the field of myeloma treatment. There are various monoclonal antibodies, there are bite or bispecific antibodies, even there is some uh, CAR T cells. So all these treatment modalities, they are basically controlling this disease in a very interesting way, so that a very dreadful disease like myeloma, the overall survival of patients, which was initially like 40 to 50 years back, it was on an average was approximate 1 year. Now, the myeloma patients, they are able to live a life. They are having a life expectancy of more than 8 to 10 years, depending upon the stage and various other conditions also. And uh, on medications, their quality of life is improving in a very interesting way. So, this is for now. If you find this video helpful, then don't forget to hit the like button. If you have any query regarding this topic, you can also comment. I will definitely try to answer your comment. And if you feel this video can help someone, you can share it with some of your friends. And if you are new to this channel, and if you like this kind of content, you please consider subscribing to my channel. And this is my channel, Medschool Simplified Medical Lectures. In this channel, I try to simplify various medical topics so that it is easier for you to understand.
Audio Jungle.